Right now, in your medicine cabinet or in your purse or sitting on your kitchen counter, there is probably a bottle of something you consider completely harmless. You've taken it for headaches, for fevers, after dental work, after a knee replacement. Maybe you take it every single night just to get comfortable enough to sleep. Your doctor may have even recommended it specifically because it's gentler on the stomach than ibuprofen. It is the #1 over-the-counter pain reliever in the United States. It is trusted by more Americans over 60 than any other medication in existence. And it is the single leading cause of acute liver failure in this country. Not alcohol, not a street drug, not some obscure prescription medication with a black box warning. This. The thing you probably took this week. 56,000 Americans end up in the emergency room every year because of this one medication. 500 of them die. And the terrifying part is most of them never saw it coming because it doesn't warn you. Your liver doesn't send you an alert. There's no pain while the damage is happening. By the time you feel something, the window to act is already closing. The medication is acetaminophen. You know it as Tylenol. And what I'm going to show you today is not a reason to panic. It's a reason to finally understand exactly what's happening inside your body every time you take it and what you need to do differently starting today. Here's the first thing I want you to understand. The number 56,000, that's emergency room visits per year from acetaminophen toxicity. That number is not from people who deliberately overdosed. That number is almost entirely people who thought they were doing the right thing. A 2020 analysis published in the journal Pharmacoepidemiology and Drug Safety found that nearly half of all serious acetaminophen overdoses in the United States were unintentional. People following the directions on the label, people doing exactly what they were told to do. How is that possible? Because there is something the label does not tell you, something that no one explains at the pharmacy counter. Something that once you understand, it will permanently change how you look at that white bottle in your cabinet. And it starts with your liver. Your liver is doing roughly 500 different jobs right now as you watch this. It is filtering your blood, producing bile, regulating hormones, converting nutrients, and managing a constant stream of everything you eat, drink, breathe, and absorb through your skin. Every single thing that enters your body eventually passes through your liver for processing. And one of the liver's most important weapons, its first line of defense against chemical damage, is a compound called glutathione. Think of glutathione as your liver's bodyguard. It neutralizes toxic compounds before they can tear apart liver cells. It is the reason your liver can handle the occasional glass of wine, the preservatives in processed food, the environmental chemicals you encounter every day. Glutathione is what stands between a toxic exposure and actual cellular destruction. Now here's what acetaminophen does. When your liver processes acetaminophen, it produces a byproduct, a toxic metabolite called NAPQI. Under normal circumstances, your glutathione swoops in and neutralizes NAPQI before it does any damage. Works perfectly. No problem. But here's the catch, and this is the part nobody tells you. Every single dose of acetaminophen depletes your glutathione supply. A little here, a little there. Each pill draws from that reserve. And when you take it regularly, especially in combination with other medications that also require glutathione to neutralize that reserve, starts to run low. When glutathione is depleted, NAPQI has nothing to stop it. It begins binding to liver cells directly, destroying them. And because the liver is processing everything silently below the level of any sensation, you feel absolutely nothing while this is happening. Now, let me show you something that I think is genuinely alarming, and this is where the risk becomes very real, especially for people who are managing multiple conditions. Acetaminophen is not just in Tylenol. It is the active ingredient in over 600 different medications sold in the United States. 600. It's in NyQuil and Dayquil. It's in Theraflu. It's in Excedrin. It's in Alka-Seltzer Plus. It's in Robitussin. It's in Benadryl Allergy Plus Cold. It's in prescription painkillers like Vicodin and Percocet, which combine acetaminophen with opioids. And here's where the math becomes dangerous. Let's say you're dealing with a bad cold. You take 2 extra strength Tylenol for your headache. That's 1,000 milligrams. Then before bed, you take NyQuil to sleep, which also contains acetaminophen. By morning, you reach for 2 more Tylenol because you still feel terrible. Then someone hands you a Percocet left over from a knee surgery because the pain is getting worse. You didn't know Percocet already contains acetaminophen. By that evening, you have already, without any intent, without any awareness, exceeded the threshold where your liver begins to lose the battle. The maximum daily dose that the FDA considers safe is 4,000 milligrams. But here's what they do not prominently advertise. For people over 60, for people who drink alcohol, even occasionally, for people who are not eating enough protein, for people who take it regularly rather than occasionally. The actual safe threshold is considered to be 2,000 milligrams per day by many liver specialists, half the listed maximum. And here's the part that genuinely shocked me when I looked into this. Acetaminophen has a pain relief ceiling. There is a dose above which it simply does not provide any additional pain relief. You take more, you don't feel better. But your liver damage continues to increase linearly. Dose goes up, liver damage goes up. Pain relief, it stopped responding 2 doses ago. This is not a hypothetical. A 2018 review published in JAMA Internal Medicine analyzed 24 clinical trials and concluded that acetaminophen provides little to no additional benefit for chronic pain at doses above 1,000 milligrams. People are doubling and tripling their doses for pain relief that physiologically cannot increase, while their liver is absorbing the full consequence of every milligram. Now, I want to talk specifically about why this matters so much more if you're watching this and you're over the age of 60, because this is not a uniform risk. Age changes the equation dramatically in ways that most physicians are not communicating clearly. Here's what happens as the body ages. First, glutathione production naturally declines. The very compound your liver depends on to neutralize acetaminophen's toxic byproduct, your supply of it is lower at 65 than it was at 35. Your liver's main line of defense is already working from a reduced reserve before you take a single pill. Second, the liver's overall processing efficiency slows. The same dose of acetaminophen that a 35-year-old clears in 4 hours can take a 6-8-year-old 6 to 8 hours to metabolize. That means the toxic byproduct lingers longer, glutathione gets depleted for a longer window, the damage accumulates. Third, and this is the one that I think is most underappreciated, protein intake tends to drop with age, and glutathione is made from amino acids which come from protein. When protein intake is low, glutathione synthesis is impaired. Your liver is trying to rebuild its defenses after every acetaminophen dose, but it doesn't have the raw materials it needs, so the reserve keeps declining. Fourth, most people over 60 are on multiple medications. Not 1, not 2. The average American over 65 takes somewhere between 4 and 7 prescription medications daily. Many of those medications also go through the liver's detox pathways. The competition for glutathione is higher, which means the reserve gets depleted faster. And fifth, alcohol. Even moderate occasional alcohol use dramatically lowers the threshold at which acetaminophen becomes toxic. The combination specifically impairs the liver's ability to recycle glutathione. The FDA warning on the bottle mentions this, but in small print that most people genuinely never read. This is not about terrifying you. It's about giving you information that actually changes the calculation. Because if you're 62, managing arthritis, pain, taking a statin, a blood pressure medication, a sleep aid, and having an occasional glass of wine with dinner, and you've been taking Tylenol every night as needed for the past 3 years, your liver has been quietly absorbing a burden that your blood work may not yet reflect. That's the insidious part. Standard liver enzyme tests, the AST and ALT that show up on your routine labs, can look perfectly normal until significant liver damage has already occurred. The liver has enormous functional reserve. It can lose 60 to 70% of its healthy tissue before a standard blood test begins to wave a red flag. By the time the numbers look bad, the situation is already serious. Here's something that I find remarkable, and I think you will too. When someone comes into an emergency room with acetaminophen poisoning, doctors do not reach for another medication to counteract the liver damage. They reach for something called NAC, N-acetylcysteine. NAC is not a pharmaceutical compound invented by a drug company. It is a form of the amino acid cysteine, one of the 3 amino acids your body uses to manufacture glutathione. NAC works because it rapidly replenishes the glutathione supply that the acetaminophen depleted. It gives the liver the raw material it needs to rebuild its bodyguard and stop the toxic byproduct from continuing its destruction. This is the standard emergency treatment. It has a very high success rate when administered within 8 to 10 hours of overdose. After that window, the damage accelerates rapidly. Now think about what this tells us. Emergency medicine has known for decades that the mechanism of acetaminophen liver toxicity is glutathione depletion, and that replenishing glutathione is the solution. This is not a secret. It is in every pharmacology textbook. It is the established consensus treatment in every ER in this country. And yet at no point in the standard medical encounter does anyone suggest that a person taking acetaminophen regularly should also be supporting their glutathione levels. No one says, here is what this medication does to a critical liver compound. Here is how you might protect yourself. The information exists, it just doesn't travel downstream to the person holding the bottle. Here's the question worth asking, and I mean really asking seriously. If you're taking acetaminophen regularly, every night, several times a week, the question is not, how do I take it more safely? The question is, why is the pain still there in the first place? Because acetaminophen does not address any root cause of any pain. It blocks the brain's perception of the signal. The signal is still being sent. The tissue generating the signal is still generating it. The medication just intercepts the message before it becomes conscious experience. And in the meantime, whatever is producing that pain, the inflammation in a joint, the nerve compression, the muscular tension continues. For most people over 60 dealing with chronic joint pain, muscle aches, and general body discomfort, the dominant driver of that pain is systemic inflammation. And systemic inflammation, in the vast majority of cases, has a nutritional and metabolic source. Linoleic acid from processed seed oils, oxidizing in the joints and connective tissue. Unmanaged blood sugar creating advanced glycation end products that stiffen cartilage and joint tissue. Magnesium deficiency allowing muscles to stay in a semi-contracted state indefinitely. Omega-3 deficiency, leaving the inflammatory cascade without its natural off switch. None of these are addressed by acetaminophen. They continue, and the medication continues to be needed because the root is still in the ground. So what do you actually do with all of this? I want to be very clear. This is not about eliminating acetaminophen from your life forever, cold turkey, starting tomorrow. For acute situations, fever, post-surgical pain, a severe headache that is disrupting your ability to function, it remains a tool. What this is about is changing 3 things. How you protect your liver when you do use it, how you reduce your dependence on it, and how you give your body the compounds it needs to not just survive acetaminophen, but to actually repair. Step 1. Start tracking your total daily acetaminophen load. This is the most important thing you can do immediately. Before your next dose of anything, read every label of every medication you take. Look for the word acetaminophen. Also look for APAP. Also look for the words pain reliever in the active ingredients. Add up what you are actually consuming across all sources. Most people are genuinely shocked by this number. It should stay under 2,000 milligrams per day if you are over 60 or drink alcohol occasionally. Under 3,000 if you are otherwise healthy and do not drink. Step 2. Support glutathione production before and after each dose. NAC N-acetylcysteine is available without a prescription. A dose of 600 milligrams taken alongside acetaminophen gives the liver the raw material it needs to replenish the glutathione that the drug will deplete. This is the same compound emergency physicians use at much higher doses in overdose situations. Used preventively at 600 milligrams, it is a meaningful protective measure. Additionally, selenium, a trace mineral that is widely deficient in the American population because of soil depletion from industrial farming, is a direct precursor to glutathione synthesis. A 2019 meta-analysis in antioxidants confirmed that selenium adequacy is significantly correlated with glutathione levels in the liver. 2 Brazil nuts per day delivers approximately 150 to 200 micrograms of selenium, roughly the entire daily requirement from food, no supplement needed. Cruciferous vegetables, broccoli, Brussels sprouts, cauliflower contain compounds called glucosinolates that stimulate the liver's own glutathione production. A serving of broccoli 3 times per week is not a minor thing for liver health, it is measurable. High-quality animal protein is essential. Eggs especially, because they contain all 3 of the amino acids the body uses to build glutathione: glycine, cysteine, and glutamic acid. 2 eggs provide meaningful precursor support. This is not incidental. This is the raw material. Step 3. Address the underlying inflammation that is driving the pain. Remove refined seed oils from your diet. Canola, soybean, corn, sunflower, safflower, these are the primary dietary source of linoleic acid that drives the oxidative cascade underlying most chronic joint and muscle pain. Replace them with beef tallow, grass-fed butter, ghee, or coconut oil. Add omega-3 fatty acids. A minimum of 2,000 milligrams of combined EPA and DHA per day. Sardines in olive oil 3 times per week deliver this more efficiently than most supplements, along with coenzyme Q10 and vitamin D3, both of which support liver function and anti-inflammatory pathways. Magnesium glycinate 300 to 400 milligrams before bed addresses one of the most common and underdiagnosed drivers of muscle pain and tension in people over 60. A 2017 review in Nutrients found that magnesium deficiency is present in up to 68% of Americans and is significantly correlated with chronic pain syndromes. Muscle cells that are low in magnesium cannot fully relax. They stay in a semi-contracted state. That is the pain you are taking Tylenol to manage, and it is addressable at the root. Step 4. If you are using acetaminophen regularly for sleep-related pain, stop using it for that purpose before you solve the sleep problem itself. Sleep deprivation dramatically increases pain sensitivity. The more pain you feel, the more you take, the more you take, the more your liver is exposed, and the cycle deepens. Magnesium before bed, glycine at 3 grams before sleep, and consistent sleep timing address the majority of age-related sleep disruption without any liver burden whatsoever. Step 5. Talk to your physician about alternatives for chronic pain management, specifically about the role of anti-inflammatory nutrition. Most pain management approaches in conventional medicine default immediately to medication because nutrition is almost never part of the clinical conversation. It is not because your doctor doesn't care. It is because it was not part of their training. You have every right to ask the specific question, can we talk about what dietary changes might reduce my inflammation load before we talk about increasing this medication? That question changes the direction of the entire conversation. The liver is one of the only organs in the human body with genuine regenerative capacity. If you stop the damage, it can repair. Not overnight, not in a week, but it will repair. The biology is on your side. What works against you is not knowing what the damage source is. Now you know. 2 Brazil nuts, 1 serving of broccoli, eggs 3 times a week. NAC if you continue to need acetaminophen occasionally. Read every label of everything in your cabinet today, not someday. The white bottle's not going away, but the way you use it and the way you protect yourself around it, that can change today. Now, there's one more thing connected to all of this. Your liver is doing a second job that almost no one talks about, and when it starts to fail at that job, the symptoms show up in ways that look like 10 completely different problems. I put that video right here because if you watch this one, you need to watch that one next. Before you go, drop a comment below. Tell me, what state are you watching from, and have you ever been surprised to find acetaminophen in a medication you didn't expect? Write it below. I read every single one.